think we'll get 2 minutes on the clock, and your time starts now. All right, so here we have a not uncommon problem, unfortunately. And so let's have a look at some answers here. Now, important to remember with diabetic foot ulcers, the situation can turn pretty toey pretty quick. It's usually not the patient's sole problem, but with good medical care, the wounds can heal. And if you thought I wrote this question just to make those puns, you would be able to 100% correct, and I couldn't help myself. So what are the most important risk factors to monitor for the formation of a diabetic foot ulcer? Who are those patients you need to pay extra close attention to? Tongue twisters. Patients with peripheral neuropathy and peripheral vascular disease are by far the most sensitive predictors for who's at risk of developing diabetic foot ulcers. Tied into that as well, often trauma does contribute to that, but it's definitely not as big a risk factor in terms of who to monitor, who to watch out for. So for this question here, the neuropathy and the vascular disease is going to be the bigger marks. If you do mention trauma, yep, you might get something, but it does reflect that you may not have quite the same polish or understanding of those risks. This is of course taken from the diabetic foot ulcer article from AJGP. Actually a pretty good read if it is something you're not too familiar with, to just get a good overview of patients at risk, what to be screening for, how to manage these patients, and what to do next. Could that be potentially relevant to the rest of this case? Let's find out. Let's get another 2 minutes on the clock, and your time starts now. All right, time is up. Let's have a look at some answers here. This is a question that I think might catch a few people, and this is one of those situations where being up to date with guidelines is particularly valuable. So until relatively recently, I think most people were using Augmentin for these kinds of wounds, but the guidelines have changed, and now dicloxacillin or flucloxacillin, I think most people probably be more readily familiar with the flucloxacillin, is considered to be first-line antibiotic choice for James. And I've intentionally not listed any allergies here. It is one where I think if they did specify an allergy, you might argue one way or another. But without that, they could consider accepting cefalexin, but probably with less marks involved, given it's more if you have a immediate sensitivity to penicillins, that's when that would be more indicated. So, hopefully that didn't catch out too many. For those who aren't familiar with dicloxacillin, flucloxacillin can cause renal impairment, liver impairment or deranged liver function. So if you do have someone who is a little bit more on the liver side or history of cirrhosis, things like that, dicloxacillin may be a safer option for them, but it can cause renal impairment. So it's kind of pick which organ we want to hit. Food for thought. Of course, we have another question up for this case here, so let's put 2 minutes on the clock, and your time starts now. All right, time is up. Let's have a look at some answers here. And boy, is this one a bit of a doozy. So a hypoglycemic episode where they're requiring assistance instantly takes it up to a more serious hypoglycemic event. And so if you go to the national standards for driving, forgotten what they're called, the fitness to drive standards, that's the one, there we go. They actually specify that the patient should not drive for a minimum period, which is recommended to be minimum of 6 weeks. And wow, is that a long time? But the rationale for that is that it often takes quite a long time, many weeks, for the patterns of glucose control and behavior to be re-established for any of these temporary impaired hypoglycemic awareness kind of events to actually resolve. So 6 weeks no driving. So of course, the next part here is James should not drive. You're going to get less marks if you're just saying that without specifying that time period. And tied into that, but is actually a separate response and would get extra marks as well, as James should not drive until he has been cleared to drive by a medical professional. So it's actually tying into that not only can he not drive, he needs to actually be seeing someone as well for that to happen. Now, the questions come up in the chat. Does this have to be a specialist? Not necessarily. In fact, it just says a medical professional. And this is also reflecting that many GPs have the expertise and experience in being able to identify those who are going to be safe driving again versus those who are not. Now, of course, James should take appropriate precautions when to help avoid these kinds of events happening again. And I think as long as you're putting some kind of example in this category, you're going to get those marks there. So whether it's complying with the general medical review or requirements, not driving, if his blood glucose is less than 5, or while wearing a continuous or flash glucose monitor, if the predicted glucose level is showing a downward trend towards the hypoglycemic range. Those are those things to be monitoring for and ways to kind of work out precautions in place to prevent these sudden hypo episodes from occurring. Tied into this as well is then the more kind of prophylactic measures. So don't drive for more than 2 hours without considering having a snack or some kind of oral intake. He should avoid delaying or missing meals, particularly a main meal. And James should make sure he has adequate glucose in the vehicle for self-treatment if needed. And finally, if he feels he is having a hypoglycemic episode, he should safely steer the vehicle to the side of the road before turning off the engine and removing the keys from the ignition. Long-winded, very long-winded. And I think some people would be a bit hesitant are we including too many steps here? Is this veering into overcoding? I think you could argue either way. Admittedly, it's probably the more risky response on here, which is also why I've placed it lower. But it's important to not only veer to the side of the road, but the removing the keys from the ignition means that if he does become less conscious or more confused, it's that extra barrier to actually restarting the car and potentially getting into an accident. And again, all of this is taken directly from the Fitness to Drive standards, which is why I think that would be used for the answer matrix for questions like this. Oof, we all good? We might all need a snack and a catch up and a break after this one.